Oh, yeah.
So it'll be a good refresher for me. Thank you.
Oh, sure. And it's 9 o'clock, so I think we'll get started. My name's Rebecca Nevedale, and I'm going to be your facilitator and your MC today. And Macrina, do you want to unmute yourself and say hello?
Hi, I'm Macrina Leach, and I'm a nurse with Maricopa County Department of Public Health.
And Macrina runs the immunization program there. How many kids a year do you think you immunize?
A non-COVID year, probably around 60,000 kids.
And you do grown-ups too, but.
Right, we do our number of adults have really grown. We're up to about 10 to 15,000 adults a year.
Yeah. Yeah, so Macrina knows a lot about giving shots. We've both been members of TAPI, the immunization coalition here in the state, for a lot of years. TAPI has about 400 members, and a lot of your fire departments might be members of TAPI already. We are a public-private partnership and know a thing or two about outbreaks and pandemics. We were formed in one, the measles outbreak in 1993, and since then have been collaborating with groups to work on a variety of outbreaks and pandemics. So measles, mumps, pertussis, H1N1, and now, of course, the biggest that any of us have seen through COVID. And we really have learned over the years that working together and creating those cross-sectoral partnerships makes a huge difference. So we have seen disease trends go the opposite direction because of partnerships. And we really want to thank all of you for what you do every day. Even if you've never heard of TAPI before, you support our mission every day. You keep us safe as residents and as just individuals, and do a lot around injury prevention. And for public health, that's kind of our core, is how do we prevent things from happening in the first place. So we just feel like none of you get credit for everything that you do in our world. So wanted to thank you. And like I was saying a little bit to Branley when we signed on, this training is really directed to those of you who are going to be leading a team to plan and implement a mass immunization clinic. And when we say mass immunization clinic, we mean you are vaccinating 50 people, 100 people, 1,000 people, however many you can get and have shots for. And we know a lot of you are doing this right now for this year's flu season, 2020, 2021 flu season. But there's also those of you who probably aren't doing anything for flu this year, but are starting to prepare and think about the eventual COVID-19 vaccine. So whether you're doing this training because you're kind of knee deep in planning these events for flu, or you're just starting to think about COVID, it's going to have good information for you either way, because some of the stuff won't change. How you select a site, how you need to set it up, that's not going to change whether it's flu or it's COVID. What's going to change is more what we know about the vaccine and the storage and handling. And we're not going to talk about potential vaccines today. We'll wait until the vaccine's out to give you that information. But I did want to launch a poll here because we thought it would be helpful to know what you're doing in the next couple of months. So you're going to see this poll pop up on your screen. I'll give you like 20 seconds to answer it. If you have multiple screens on your, plugged in, you're going to want to look to the other screen if you don't see a poll that just popped up. But let us know, are you planning a flu clinic in the next couple of months? Are you staffing one, or are you just here to think about setting up for COVID? And we'll give you just like 5 more seconds to respond to that. All right. So I'll share the results here. So it looks like most of you are here because you're starting to think about the COVID-19 vaccine. That's great. But some of you are doing flu clinics in the next couple months. Or staffing them. And some of you are not sure. That's okay. A lot of us don't know what we're doing one day to the next, but you showed up to work today and you logged on to this thing that was on your calendar. So thanks for joining us. We do have a good representation from about a third of our counties here in Arizona. Most people on their line are from Maricopa County, followed by Pima, but we have a huge in terms of the non-Maricopa County folks, a lot of you from Cochise County, which is exciting because we don't tend to get a lot of people from outside those two big ones. So we're really excited about that. And I have one more poll that's going to help us know a little bit more what we're walking into with you today. So which best describes your level of experience with mass immunization clinics? Have you planned them in the past? Have you attended them but not planned them? Or are you kind of walking in blind today? All right. Give you 2 more seconds. All right, so we have about a third of you have planned these things in the past, which is great. And about a third, a little more than a third of you have attended one but not planned one. And then about a little more than a third of you are, like I said, kind of coming in a little bit more blind. So here's the deal with this training. So Macrina and I have done countless trainings for medical assistants and other folks who do vaccines throughout the states, doctors and nurses, and we are pretty informal. You will see us interrupt each other for the next, hour or so. Please interrupt us too. We really do believe that what it takes to provide immunizations in your environment. And you are the experts. You probably all have similar questions. And for that third of you who have done this before in the past, you're the ones who really know the stupid little stuff that's going to make a huge difference when Rio Rico tries this out for the first time, or Yuma, or Mesa tries partnering with a grocery store for the first time, or whatever those cases will be. So we really need you to talk. And to do that, if you're on the phone, you press *6 to unmute yourself. You can hover to the bottom of that Zoom screen, and on the bottom left there, you'll see where you unmute yourself. You can mute and unmute yourself there. And then we hope that you share your cameras if you have them, and if you're allowed to share them. So, but yeah, interrupt us as much as you think you need to do. So everyone has permission to do that. And okay.
It's more fun. It's more fun that way.
It's more fun that way, and honestly, nobody wants to hear us talk for an hour and a half. So I've been told I have one of those voices. So we wanted to start by going through some resources and checklists and stuff, and I'm going to show you where to find these. So on our website, tappy.org, you're going to hover, and we'll send you this link ahead of time too, but this is for if you want to also do this while you're sitting on the computer. You're going to hover over this providers tab here, and you're going to see a tab for mass immunization trainings and one for resources. So we have gone through and reviewed a bunch of existing resources that aren't all completely outdated and are going to put things here that we think are going to help you. So we have a bunch of checklists. We have some things specific for drive-through immunization clinics, because we think that a bunch of you are probably going to try to do that and have some experience doing that for COVID testing already. We'll link some other webinars and presentations on here and just have some examples. So I'm going to click on just a couple, the ones that I think are most important. So that first one is a checklist from CDC. And this is for anyone who's doing vaccines outside of a doctor's office. So that is you. And typical CDC handout, it's like 8-point font and 1 million pages. But if you have time, we'd really urge you to look at it, because it is pretty good and goes through a pretty exhaustive list of what to do before the clinic, what to do during a clinic, and what to do after the clinic. So this isn't like you must do all of these things. If you do, but even if you read it, you're going to think of stuff you haven't thought of already, if that makes sense. Anything about this one, Macrina, that you want to make sure that they know about?
No, I like when it says no, stop. So if you answer no to that, then the question is, how do I make that a yes? And again, you don't have, just read through everything to make sure you've covered most of the points.
Yeah. And this has been updated around making sure that it's COVID safe and you are thinking about keeping people physically distant and PPE for your staff, having extra masks on hand for any client or patient that walks in that isn't wearing one. And then at the very end of this, and I know this makes some people pretty dizzy when I scroll this fast, I'm so sorry about that. There's a bunch of additional resources for things. So the other one and CDC handouts are, CDC is who we look to for all of these things. They are disease prevention, right? And there's an FAQ sheet for that because we needed an FAQ sheet to understand the handout after a conference. So that was created for you. This is another really good one that's around supplies. This is from You Call the Shots, which is the CDC training program for vaccine storage and handling. And we'll make sure to email you the link to that as well after this training. We'll talk a little bit about it today, but it talks about clinic supplies that you need to administer vaccines, making sure you have, trash cans, what forms are you going to need to document the vaccine was delivered and to who, and just general office supplies. So that's a really good one. And I think this is the one that we added for tips. Yes.
Mm-hmm.
Checklist for storage and handling. So there are all these checklists on here. If you're doing drive-through clinics, there's resources from CDC and ADHS. And then all those other things. So the other thing that we're going to put on here is template workflows. So this is one that was created pre-COVID. And how can I tell that? Because there's lots of groups of people.
Right. The thing that you really need to remember, which is an assumption with all planning, you do events, you need to make sure you have enough space to socially distance at least 6 feet apart families. And a lot of families can be pretty large, so that could mean for a lot of extra space. So this just really covers the sort of the stations you will have. Not necessarily how close they are. You're really going to want to spread these out.
And you can even, a really great spot is going to have those in different rooms, right? So the greeter, where the patient comes and checks in.
Right. One large room will work, but what really works out best is if you have multiple small rooms, like you have that greeter and that health check room. And then you have that, here's how you fill out the consent forms and gather some billing information. Congratulations. Now you guys can bill access for administration fees. So you're going to want to collect that information. Then you're going to have the actual vaccine administrations room. So actually the best case scenario is if you could use a place that will give you multiple small rooms.
Okay. So I think because about a third of folks have not done this yet, we'll go over a couple other kinds of workflows. So that's one way to, I think it's just helpful if you haven't done it yet. Like, what am I actually talking about? What's it going to look like? So this is from the module that you were emailed before the training, and Macrina is going to talk about that module in a minute, but just one flow chart, like a visual of what it's going to look like. So patient comes, there's a greeter that screens them for COVID. If they fail the screening questionnaire, then you send them home. But if they don't, then they're going to go over to clerical, get their insurance verified. Clerical is also going to look up their vaccine records in ACES, which is the state immunization registry, so that yes, that patient is due for the vaccine. They haven't had it before. Then they will go right over to medical, where they'll screen them for any precautions and contraindications and then administer the vaccine. Here's the same kind of flow chart, just depicted differently. I think for those, if you are someone who's leading a team, and I know that you already know this stuff, but not everybody learns like you. So maybe for you, a really detailed list of 80 different steps that have to happen makes a lot of sense and helps you not forget things. But just know that some of the folks on your team are visual. So anything that you can do to draw this out is going to be helpful. For vaccine administration, we need to make every effort to make sure that every person does the same thing with every patient every time, because you want to reduce errors. You don't want needle sticks. You don't want the wrong vaccine given to the wrong patient. I mean, accidents are going to happen, but as reliable of a system as you can create, the less likely you are to have those errors. And then here's another way to depict, this is a swim lane diagram, what that process will look like. And it's a little bit more detailed. This was based off of a lot of the drive-through clinics, folks who are doing drive-through vaccines and COVID testing are having patients make appointments. I don't know how a fire department would do that, but because that's a whole other, these are mostly clinics that are doing that, like federally qualified health centers that have appointment systems. But this is what it's looking like for them. The patient makes an appointment, they arrive at registration. If they are, they pass the screening questionnaire for COVID, then they go over to the clerical person who registers the patient, verifies insurance, looks up their vaccine record. Then the vaccinator gets the patient, screens them for contraindications and precautions. The patient completes that screening questionnaire. The medical person reviews it, gets consent from the patient, counsels them, verifies their standing order or proposes their order, gets the vaccine, sticks the patient, counsels the patient. Patient waits for 15 minutes, and then they document and discharge. And again, fire departments are able to bill access now for the vaccine product. Did you guys know that already? Anybody wants to chat in or unmute yourself to let us know if you know that already? Yes, okay. Oh, some people didn't. Well, we just made you money. Look at that. Well, not yet, but we will. So tell your boss, you're the one who figured out how to get more money. So tell us about this module, Macrina.
So this module we put together to walk people through and folks through how to set up a mobile immunization clinic site. And it really goes from the first step, which is how do you select your site, all the way through to vaccine administration, screening, and then, thanks and have a great day sort of flow. If you are somebody who is in charge of coordinating events, I would recommend you go through the whole thing and you click on all the links. The links will take you to CDC, it'll take you to the Vaccine Information Center, it'll take you to some resources as far as consent forms, inventory forms. If you have a specific role, which is you're the vaccinator or you're the person who draws up vaccine or you're the person who transports vaccine, then you can definitely go to certain pieces and download those for yourself. And this is exactly what we go through, the process we go through every time we do something remote or out in the community outside of our clinic setting. And this presentation, we're going to review really how do you select your site and really roles and responsibilities and some vaccine storage and handling pieces.
Yeah. So I want to pause to see if anybody has any questions about resources, but also, do you have checklist for those of you who've already done this? Do you have your own checklists already? Remember, it's going to be very boring if no one talks but me and Macrina. You can unmute yourselves. So I'll take that as a maybe not. If you do have them, so like COVID screening, that's good. So I mean, resources for mass immunization clinics. If you already have checklists or templates, we'd love to be able to post them on our website. But even if we can't post them on our website, if you can't get permission to do that, if you can email them to us or in that chat feature, you can attach files right there in that chat feature, and just to be able to share them with the people who logged on today. Some people are doing this for the first time, as we saw, like in the next couple months. And anything you can do to make their lives a little easier is going to be appreciated. And if you, as you kind of get your feet wet and start running more of these clinics during flu season, if you know you need a resource, or you think, oh, geez, this would have been really helpful last week when we did that, let us know, because we can always find something, or we can create it.
We love to create forms.
Yes. And then the other kind of offer for help too, I want to make sure you see in the chat, is that if you just learned that Access is letting you bill and want to get help thinking about how would you do that, contact Tappy, because we do have a billing program that we work with the counties on. So let's dig into content. So before finding a space, so we're going to talk today about how do you select a site. We're going to talk about vaccine storage and handling, and we're going to talk about how do you staff a site. So before you even find a site, you have to build relationships. This is like the basics of everything that we do in injury prevention and in public health, but it's really important for vaccine delivery. Number one, who are you going to get your vaccine from? You're going to need to know who you get that from. The counties are a good partner for that, because they have lots of vaccine that they, how many nurses do you have in Maricopa County that give vaccines? 60,000 of them a year?
Actually, I have 8 that are dedicated to doing vaccines, and then I have 5 that help fill in.
Yeah.
So Maricopa County, we have a lot of flu vaccine. I can't speak for the other counties out there, but they're a great resource and a great partner. So just give them a call.
Yes. And you also need relationships when you're running the clinics, who, if you need extra staff, if you get a bunch of employees who get sick the 2 days before your event, you're going to need people in there to be able to immunize. So who can you pull from in the event that you do need staff? And then who can help get the word out about these events? So we know that you all have marketing departments and things like that, but if you find a good partner, they will get the word out for you, and they will be more trusted. So if you're partnering with a church, it's going to go much better if their pastor tells them from the pulpit the week before that they're going to be there, than if you put a flyer in their grocery store or something like that. And then the second thing you need to do before finding your space is figure out your own IGA process to get agreements in place with your health department. So how much do they need to be able to pay you to afford to be able to host these clinics? Do you need to write additional grants to be able to host the clinics? What's the process for the IGA? Does it have to go to city council? Does it, or is it something that's fairly easy to get that? Because Macrina, they're all pretty much, most of these folks are going to partner with the counties, right?
I don't know that question. I know that in Maricopa County, we're partnering with our local fire departments and EMS, but I can't speak to what the other counties are doing. But it doesn't hurt. Pick up the phone and ask and talk to them. I always say the worst answer could be, no, we don't have any money to have agreements, but let's see how we can work and partner together to still get immunizations out in the community. So they're always a good resource to pick up the phone and ask. Tappy's a good resource to pick up the phone and ask, hey, is there somebody out there looking to throw some money at an immunization event?
Right.
So, the worst thing that could happen by asking is they say no. So you just move on. But definitely ask a lot of folks.
And know your process of what formal,
Right.
Your agency, your city best. So if everything takes, 3-4 months, it feels like, to get in place, then you're going to need to start working on that now, right?
Yep.
And the third thing you need to know before you find a space is, who are you going to target? So come COVID, you might just be doing events for city employees or essential personnel, just your fire department. But for flu, are you targeting just kids? Are you, for the first time, uninsured adults now have access to flu shots? I mean, that is huge for us as a community. So if you are able to get a hold of that vaccine, if your county says, hey, we have some vaccine available, for uninsured adults. You're going to want to know, talk with your partner about how many of those people they expect that they can get in the door, so you know how many shots to come up with. If you are just doing kids, you might think, that takes more or less time, for a family of 5, but there's only 3 children. I'm only going to immunize those 3 people because we only have vaccines for children. We don't have vaccines for adults. So that's a different workflow than if you have a family of 5 that comes in and you can immunize everyone in one sitting. So that anticipated demand's hard, but your partner is going to be able to help you do that better than you will probably. And time of year, we just got, for those of you not in Phoenix, it's been awful this summer. Your shot clinics looked very different, didn't they, Macrina, when it was 120 degrees? And
especially when now you have to social distance and you can't have your lobby or your waiting room filled with people. So you can't have people waiting outside when it's 115. So you have to be a little bit creative.
right.
If you're up north where it could be rainy, you just really got to think about your time of year here.
Yeah, like not partnering with someone who's on the road that during monsoon always has a flash flood. You don't want people stuck there forever. Or maybe you're in a region where you have a lot of snowbirds and that there's a lot, population really fluctuates at different times of the year or when school's in session. All of these things are gonna impact how you set things up. So Macrina, tell us what else they have to think about in terms of organizing events.
One thing you really need to have is you need to designate a coordinator. Somebody who's in charge, someone who gets the big picture, someone who works with your site, wherever you're offering your immunizations, who can kind of work out all the possible troubles you might have. You want to garner support. You really want to get support from the person who's hosting the site. You want them to help you by advertising, by getting the word out, by being that trusted partner that are going to bring people in. You're going to review your best practices with your staff. You're going to make sure that everyone's safe. Physical safety, as well as the vaccine is stored and handled safely. Sharps containers, things like that. You want to make sure you have vaccine and supplies. Again, partners. You don't want to go through all this work to do a community-based immunization event and have no one show up. And then you have protocols in place. I think the more you have protocols in place, the more you've standardized everything. When you take it out into a non-traditional medical setting, it makes for less risk of errors. And it also helps to have protocols so that everyone's saying the same thing.
Right.
The first thing you need when you're selecting your site, who do you really want to immunize? Are you going to do families? Are you going to do the older adults? Are you going to do just children? There's a lot of pieces you need to know. Who are you focusing on? Are you focusing on just flu vaccine? Are you focusing on the 6th grade required and recommended vaccines? And how many do you expect? Because that depends on your staffing. What vaccines will you offer? Again, I talked about that. You gotta know what you're going to advertise for, and when will it be?
The other thing too, with what your vaccines you're going to offer, remember that depending on funding source, different vaccines have different requirements for inventory management. So you need to know what vaccines you're going to offer for sure, and who's paying for them. Are they federally provided vaccines? Because if so, you need additional training and additional kind of quality assurance mechanisms to know which dose got into which arm, so that you can put that into ACIS and then decrement that order, so that you can inventory. And if you have questions or anything about that, make sure you speak up or put them in the chat, because we're going to talk a little bit more about inventory management at the next training.
And when it will really be important. If you're going to offer vaccines on the first day of school and those vaccines required for school, you're going to be inundated with huge numbers. If you're going to be offering a program 3 days after school lets out, you're probably not going to be as busy. So really when you have your event is really going to probably give you a good idea of how many crowds and how many people you're going to see.
All right, time to look for real estate.
Okay. So there are some physical things you really want. In Arizona, you really want electricity. Now, in Maricopa County, temperature is really unstable this year. So electricity is always helpful. Air conditioning is always appreciated. You need to have restrooms, definitely. And having learned this from experience, make sure that the restrooms will be unlocked when you're there. Because just to have, yes, we have restrooms, sometimes when they're not, if it's a school or a church or community center, they're usually not unlocked unless they're open. So just make sure that you know where the key is. Make sure you have a separate entrance and exit. They're going to come in one door and out the other. That is really going to help with your flow of clients, so they're not running into each other. Traffic flow. So if you're going to be doing a small community event or a large community event, you need to know that there's easy in and out, that there's good parking. You also need to have physical distancing, make sure you have enough space. You want to make sure you have running water or hand washing stations. You can use hand sanitizer in between clients and in between gloving, but it's always nice to have that spot where you can go wash your hands. And you want to have a place for a first aid station. Routinely vaccines, you don't have emergency situations, but sometimes you have the adolescent who might hyperventilate a bit and pass out. And you really want to have that away from the actual vaccine administration station, because that just makes folks, and especially those adolescents and young adults, get a little bit more nervous about vaccines if they see somebody pass out or have a non-vaccine side effect, as I like to call them. And then there's some added value to picking a location. You really want to pick someplace that's familiar, especially if we're, like this year, we're really focusing on populations for flu that don't have resources, either financial resources or transportation resources. Routinely, I've never thought of getting a flu vaccine because they don't have access to it or don't have the funding for it. So you really want to pick a place that's familiar.
Macrina, do not pick, tell them to not pick the Phoenix fire training facility or the Mesa training facility. Because they're very hard to find.
They're a little bit harder to find, and most of your community don't know they're there.
Yeah.
And built there so that you have a lot of space. So most folks don't know what in the heck that place is. Always pick someplace that people feel comfortable going to and are familiar with. You actually want that place you choose to help you advertise. There are places that can put it in bulletins, that can email, that can text, that can put it on a banner out in the front of a facility, but always get someone who's going to help pass the word, a trusted partner. And
if you need help with that, because especially we found, churches, you'll have someone say, I really want this, but we don't feel comfortable advertising because vaccines might be controversial to our membership and to our, congregation. And a lot of times all you need there is just a discussion with the leadership about the safety of vaccines and that, the science behind them for them to feel comfortable, urging their folks to go. And if it would help to have a pediatrician from that community or a member of TAPI to come with you to a meeting or do it on your behalf, kind of follow up with them, we can always do that to help give them the information. Yeah. And then what do they need volunteers for?
Well, volunteers always come in handy. Crowd control, keeping that social distancing, helping folks park and get their way to where you're actually administering vaccines. Just recently did an event where we were at the opposite end of where we were at a church. We were at the opposite end of where services were happening. So we needed church volunteers to sort of lead people to where we were. Assist them in filling out the consent forms. Assist them in asking questions. Again, crowd control. They can do any one of those clerical pieces that you have in your in your flow. The other nice thing about volunteers is when people see people that they know. They see their neighbor, they see their friend, they see the person, they see a church, and that's really helpful too. And a lot of these places, they have lists of volunteers. Most times I get more help than I know what to do with. So definitely enlist the volunteers. And another really added value is if you have internet access. If you have the ability to actually check ACES right then and there with a stable internet connection, if you have the ability to do insurance verification, if you do that, that is really helpful. Again, none of those in the added value are needed, but if you have them, they're going to make your program really much more successful.
Yeah, and Benjamin's chatting in too that the volunteers for the event will help market the event. So, anything you can do to take something off your plate to put it in somebody else's is good. So we wanted to see, for those of you who've done events in the past, is there anything we're missing from this list that you feel like you really want to tell other fire departments to think about when selecting a site? Security. Oh, we figured y'all would be scary looking enough, but
security. But sometimes it's just you don't necessarily have to hire security itself, but just having folks walking around, paying attention, seeing what's happening. Sometimes that's even enough. Folks who can hand out water to folks.
Yeah.
Sometimes that's enough. Somebody who can chit chat with folks who are waiting. If you end up with a crowd, it's always nice to have folks who can have a discussion with those folks who are waiting. And that usually makes things go much smoother.
So schools are, when we looked at workflows earlier, Macrina said it's really good if you have all of these different stations where you're greeted, then where the clerical stuff happens, then where the vaccine's administered, and where they wait for 15 minutes after vaccine, and then where it's documented. The entrance and the exit are going to have to be out of 2 different doors so that you don't have people cross people. And schools have all those little rooms, right? With little teeny tiny chairs.
They have little teeny tiny chairs. So just make sure you ask for some big people chairs, because after a while, the little teeny tiny chairs can get a little wearing on those of us who are aging a bit. But schools are perfect because they're either in communities where people can walk or driving. They usually have somewhat decent parking. But again, a lot of schools are in communities where folks can walk. They have adequate space, multiple small rooms or very large rooms, a gymnasium, a cafetorium, something like that. They usually have electricity and restrooms. And again, make sure that if you're there when the school's not open, that someone is there with the key. I've learned this from experience. Again, the added value is familiarity. Everyone knows about the school. Even older adults who don't have children see the children walking to school. So they know where the school is. Schools can promote for you. And what we've discovered in working with schools in the world of COVID and social distancing is that they can actually send robocalls or texts, and they can actually send it to populations by alphabet. So from 8 to 10, they're going to send the message from A to L, we're having a clinic from 8 to 10. And then from M to Z, they're going to do it from 10 to 1. So that kind of helps separate the population for you. Schools are great partners.
So let's think about pros and cons for other sites. We have a question Marianne's asking in the chat. Won't sites be reluctant to have gatherings of people due to COVID? And I think some people will. But if you've thought through how you're going to keep people separate, 6 feet apart, and be able to reassure them that, your staff's all going to be masked, that you're going to have masks available for people if they're not wearing them, and whatever protocols that you've designed to space out the appointment slots or when people come. I mean, just reassure them with those things.
Right, and we have absolutely had when we first started using school sites earlier in the year, because our lobbies at our current clinic locations aren't large enough for the crowds, they were a little reluctant, but we showed them the flow, we showed them the drawing, we showed them that we needed 4 rooms instead of 1. And so I think that having had a few successful sites, then we were able to take that story and tell it on and on. Reluctant, but I think it's about letting them know that you've really thought this through and that your ultimate goal is safety for everybody, not only the children and the folks coming and the school staff, but it's also for the safety of your staff.
Yeah, and as long as it's not, you know, winter in northern Arizona or summer in southern
Right.
Arizona, you can do outside too.
Mhm.
And a lot of places that are closed have nice big open parking lots right now. So, and
Yep.
honestly, if you're doing, I know that some of here in Maricopa County, some of the fire departments have already done drive-through COVID or drive-through flu clinics. And if you have, you know, kind of photos that you've used so that your department knows how to set things up in outdoor events in the future, please share those so that we can share them with the other fire departments. Because I think sometimes the people just need a visual. Not that you would post, you know, events on your website, but and that's a great idea too, Benjamin, saying do a walkthrough or a dry run with those involved, including the staff. Yeah, that's a great idea.
That is a really good idea.
So what are the pros and cons of churches?
So churches, I find really, I find them really good and bad in both ways. Number one is that when your minister, your rabbi, your preacher, your priest, if they get up and they make the vaccine part of their sermon, then they really do sort of get those churchgoers all excited about it, and they walk them down to the room to get vaccine. It's perfect. Usually they have multiple small rooms. Usually you can social distance. The problem with churches is that you're routinely only busy after the service. So if you have 50 people in a church service, you do nothing for the 45 minutes the church service is going on. And then all of a sudden, all 50 people are there. So you need to have a pretty good size staffing to make sure the folks can get through and that they can be socially distanced, but you really do have a lot of downtime. But if you can get if you can get the person who's doing the sermon or the service to actually, like we did a couple of weekends ago, actually use it as part of their sermon about protecting each other and being a community, then out of 150 people who attended church on that day, we immunized 138.
Yeah.
I don't think I ever would have gotten to that point if it hadn't been for the priest who really sold it.
Yeah, and you know, and I think that the other pro for churches is that they often will get to different people than you would get for schools. You know, like some
Right.
people they'll go to they don't have children, they don't want to go to school except for when they vote, and now they're doing that by mail. So, but they still go to church.
And another good point someone pointed out is that they do have a lot of volunteers because they really are a community of supporting each other. So they really will help you out and provide volunteers.
Right. What about grocery stores?
So I have a love-hate relationship with grocery stores actually when it comes to vaccines. So we really want to avoid a grocery store that has a pharmacy because they can offer vaccines. But the problem with grocery stores routinely is space. Everyone needs to go to a grocery store at some point or another. So actually, folks who only leave to go to the grocery store, it's a great place to catch them. The problem is there's not much space. There's not much ability to do social distancing. I think during COVID, most grocery stores may not let you in just because they're trying to limit the number of customers in their grocery store. The good thing about grocery stores is you can usually get a nice sized population. They're easy parking. It's sort of like added value because it's one-stop shopping. Get your flu shot, get your burritos and your ice cream, and you're ready to go. Space is routinely a problem in grocery stores.
Didn't somebody put you in the liquor department one time?
Yes, I have done a grocery store. I have been in the liquor department of every ranch market within Maricopa County. And
Well,
again,
you were good shots, Marina.
not a bad setup, but again, not much space.
Yeah.
So it really is hard to keep social distancing. But I do have a picture of me and the Bud Light.
What about these other ones?
I think parks are great locations once the weather gets better. You just need to really trust your weatherman that it's going to be a mild 75 outside. But we've done flu programs in parks a lot. And therefore, great thing about parks is there's social distancing. You can use some volunteers. So again, not a bad. Drive-throughs are good. You just need to make sure that you have a spot for people to wait. There is a recommendation to wait 15 minutes after getting an immunization, and especially if you're the driver.
Right.
Community centers are great. A lot of them are not open right now, but you may be able to have them open them for a flu event for you. And then they can contact those who are members. Childcare facilities, a little bit more difficult, small locations routinely, and business organizations.
Yeah.
Working with them actually helps. They can get out advertising. A lot of business organizations, you think, for example, schools, we've immunized a lot of school staff who are contract and don't have insurance and don't have access. But they're all possibilities. You just need to go through the pros and cons and work with your contact at each location.
Is there anything else any other kinds of sites that you all have worked with that you want to tell your friends are good to work with, or that you've worked with that are really bad to work with? Go ahead and chat that in or speak up. The other thing I'm curious about is how many of you are thinking about drive-through vaccine clinics? Because I think that is a little bit, it is definitely a different workflow. And we've been having some other conversations with folks on drive-through. So chat in or speak up if you're okay. So Nancy's saying drive-through. So there are a couple of differences with drive-through. For that 15-minute wait thing, that's the scariest thing, I think, to me, because you really want to try to make as much as you can, make someone wait the 15 minutes, but not everyone is going to. So when you set up your lanes, most of these drive-through vaccine clinics, they're doing like, say, 2 lanes, and then they have 3 staff at each table, 1 providing, and then 1 doing kind of other stuff. A lot of people are using students for that, which might be why they have 3 instead of just the immunizer. But you have to set the cars far away enough from each other that people are going to leave early, and there needs to be a road for that.
Right, and then a lot of folks are using locations where people can park for the 15 minutes and then using volunteers to actually sort of walk around the parking lot. Well, how you doing? Making sure you can't you can't make somebody stay there, but you can do everything you can to try to have them hang out sometime. But again, those volunteers sort of trolling the parking lot.
Yeah. Yeah, and if that's something that you want to, I see a lot of people are chatting in that you're considering it. If that's something you want to talk a little bit more about, let us know either now or let us know in the evaluation of this, because we can reserve some time at the training on October 22nd, the next one, to dig in a little bit more about drive-throughs. We might even be able to bring somebody on who's been doing it.
That's what I was thinking.
At the museum. So. Yeah, it's a little bit different of an animal there. So let's talk about vaccine storage and handling. We have like a 5-minute video here that says where vaccines come from. So we'll all watch that.
The journey of your child's vaccine. A vaccine must be safe and effective. How a new vaccine is developed, approved, and manufactured. Vaccines begin the journey in the laboratory, where scientists work to figure out how best to protect against dangerous germs. Before a new vaccine is made available to the public, researchers usually must do years of lab tests on the vaccine. If lab results look promising and the vaccine appears to be both safe and effective, volunteers will be enrolled to get the vaccines in a series of carefully monitored clinical trials. The manufacturer usually conducts 3 phases of clinical trials. Each phase is designed to gather more information about the vaccine safety and how well it works. These
Oh, sorry.
trials can take years to complete. During phase 1, about 20 to 100 healthy adults get the vaccine. Researchers track how well the vaccine works, whether it's safe, what is the correct dose for disease protection, and what possible serious side effects may occur. In phase 2, hundreds of volunteers participate. This is when experts learn more about the possible short-term side effects and how the volunteers' immune systems are responding. Phase 3 trials are the most informative, with results from hundreds or even thousands of volunteers. In these trials, vaccinated volunteers are compared with volunteers who receive another vaccine or no vaccine. These results give researchers a better idea of how well the vaccine works and if there are possible side effects they should expect. The Food and Drug Administration, or FDA, along with the Vaccines and Related Biological Products Advisory Committee, review all of the data the researchers have gathered throughout the trials and decide whether or not to license the vaccine. Once licensed, vaccines are made in batches called lots. Manufacturers test the lots to make sure the vaccines are safe, pure, and potent. The FDA reviews the safety and quality of each lot before it is released. The FDA inspects manufacturing facilities on a regular basis to ensure quality and safety. How a vaccine is added to the U.S. recommended immunization schedule. Once the FDA licenses a vaccine, CDC brings together the members of the Advisory Committee on Immunization Practices, or ACIP, to review all of the research available on the licensed vaccine. The members of the ACIP include world-renowned vaccine and disease experts from groups like the American Academy of Pediatrics and the American Academy of Family Physicians, CDC, and other government agencies. These experts look at how well the vaccine works and whether it's safe when given to different age groups. They also weigh the seriousness of the disease the vaccine prevents and figure out how many children would get sick if they did not get vaccinated. The experts then decide if they should recommend that vaccine be added to the U.S. recommended immunization schedule. If the CDC approves the experts' recommendations, the vaccine officially becomes part of the schedule, and soon it will be available at your healthcare provider's office. How a vaccine's safety continues to be monitored. Once children start getting the vaccine, the FDA and CDC continue to watch for possible side effects. Reactions that happen after a vaccination get reported to the Vaccine Adverse Events Reporting System, or VAERS. Anyone can submit a report to VAERS, including parents, caregivers, patients, doctors, and nurses. However, the reactions that are reported may or may not be caused by the vaccines. They may require further investigation. Researchers at FDA and CDC analyze the VAERS reports and look for any trends that may be happening. FDA and CDC also use other vaccine safety systems. The Vaccine Safety Data Link, or VSD, and the Post-Licensure Rapid Immunization Safety Monitoring System, or PRISM, actively monitor new vaccines to obtain additional information about their safety. VSD has access to healthcare information for over 24 million people. PRISM can analyze healthcare information from over 190 million people. CDC also uses the Clinical Immunization Safety Assessment Project, or CISA, to study vaccine safety. CISA is a collaboration between CDC and 7 medical research centers. CISA vaccine safety experts conduct individual case reviews and clinical research studies about vaccine safety. Recommendations for using the vaccine may change if the vaccine's risks are found to be greater than its benefits. The end goal is always the same: to safely and effectively protect children, families, and communities against potentially serious disease.
Okay, we know that part. So, and I think that So that's all the things that happen before you get a shipment of vaccine to your fire department, or until Macrina or one of her county health department colleagues come and bring some vaccine for you to administer. It's a lot. And with COVID, all those steps are all happening just in a fast, it's just sped up a little bit. And we don't show you that to talk about COVID vaccine, because when we actually have a vaccine, we'll do lots of education about it. But more just so you know that throughout all of that process, from the lab until it gets into your hands, people are maintaining that vaccine at appropriate temperatures. And there's so many people who have done the right thing before it gets to you to keep it safe. So you really don't want you or your team to be the one that messes it up, and makes that vaccine ineffective. So, and they do this all over the world. They're, on Camelback, and these are actually solar panels keeping a portable vaccine fridge safe on that camel. They hike all over the world carrying vaccine on their back. At Supai Village in the Grand Canyon, we don't hike down there to deliver vaccine. That gets dropped off by a helicopter. And all over the developing world, it's carried by dirt bikes and motorcycles. And we were excited to find a picture of them wearing helmets, because we thought, if anyone, your medic hearts would be so happy to see helmets. There's a lot of activity that goes on throughout the world to make sure vaccine is provided to the developing world, but there's also a lot of stuff going on to get helmets to the developing world that you might not know about. So Macrina, tell us about cold chain.
Okay, so I think Rebecca pretty much talked about the cold chain. There's a lot of people involved, vaccine manufacturers who ship it to the distributor. The distributor then ships it to the provider, and then the provider has to store and handle it in their own spot, and then you need that storage and handling in proper temperature as you get it to the place where you actually administer it. So it's everybody's responsibility, and as you can tell, it really is important to pay close attention to those temperatures, because it does go through so many different hands. And the last thing you want to do is have to make a lot of phone calls, because at the end of the day, you discovered that the vaccine you just administered was not stored at the proper temperature.
Yeah, because if that happens, you have to call the patients back and bring them back in. And for a lot of people, as you know, the decision to vaccinate was a hard one to come to. And so if they receive a phone call then saying we need to bring you back in, it just creates additional fears that they don't really need to have.
Right, and so staff training is probably the most important. Have policies and procedures in place. Also have cheat sheets and all that information right at hand, simply spelled out. It's really not as hard as it sounds. It really is pretty basic. So here's my favorite slide. I actually hate this one because refrigerator temperature's ideal is 40. You want to keep it between 36 and 46 is your ideal for inactivated vaccines, which include your flu vaccine. Now the freezer is completely different. If you're storing some of those frozen vaccines, they need to be kept at a negative 50 degrees Celsius to negative 15. This is why I don't like this, because you should pick one form of measurement, either Fahrenheit or centigrade. Don't toggle back and forth, because that's where mistakes happen. One or the other, do not use both. Make sure that you have something on your unit that says do not unplug. The last thing you want is someone who's going to buff your floors to unplug your vaccine refrigerator or freezer and then not plug it back in. I find putting the unit in front of the plug the most helpful, but do not unplug will help as well.
And the water bottles are important, right?
Water bottles are important. The best thing about the water bottles is what that will do is if that unit does get unplugged inadvertently, or your electricity does go out for a short period of time, those water bottles will help maintain the temperature in both freezer and refrigerator, so that you don't have to run in and move vaccine. And again, just don't open it. What you're going to have is your probe is going to be inside the unit, but your ability to monitor the temp is going to be outside that unit. It's just like my dad used to tell me when the electricity went out, don't keep opening the refrigerator. You keep it closed, it'll maintain temperature for a good time without you having to move it.
Do most of you on the line, will they even have fridges?
Pardon me?
Will they all have a refrigerator where they're storing vaccine, or some people are getting
I
it
think,
delivered right to the site?
I think it's probably going to be a little bit of both. I think some places will have the ability to store vaccine. I think some places won't. One thing you do need to make sure, though, is that it is a designated refrigerator for vaccines or biologics. You can't use the lunchroom refrigerator. You can't store it along with food. So you do need to have a designated unit.
Right.
So for an outreach clinic, you want to make sure you have supplies. Typical hard-sided ice chest works perfectly fine. If you want some ice packs, cooler packs, you definitely need to have a barrier between the ice packs and the vaccine. We use bubble wrap. You can buy it from Amazon, buy the large roll. And if you get stressed, bubble wrap works as a way to kind of get rid of that stress. Just pop those bubbles. And then you also need to have a data logger, something that will monitor the temperature. The one thing you need to keep, we're going to talk about flu right now. The one thing you really need to remember is that getting flu vaccine too cold will kill it. You cannot freeze it. So that's why the barrier in between the vaccine and the ice pack is so important. Years ago, I did a program in the middle of winter, and actually the vaccine on the bottom and the vaccine on the top was frozen because the ice packs were sitting directly on top of it. So once your vaccine freezes, it's no good. So just make sure you put that barrier in between.
And was that whole, did you have to pitch that whole?
We only had to pitch the vaccine that was actually frozen.
Okay.
Because the temperature, the temperature itself, which was located in the middle of the ice chest, read an appropriate temperature. It's just that when you pulled the vaccine out, it was solid.
Mm-hmm.
That's why you always
do when you have to waste a vaccine for that, depending on the funding source, it's a lot of paperwork too. So if that's a VFC vaccine and you're a VFC provider, that you have protocols that you have to take to, stop providing the vaccines in that cooler or from that fridge. And it's just, there's a lot of hoops if it's federally provided vaccine.
Right. So again, just make sure, if I can say this a million times over, make sure there's a barrier in between the ice packs and the vaccine. Make sure that you put the probe in the middle. You have the temperature monitor on the outside. You're going to be fine. 3 important things. Inventory management. You're going to pay attention to your inventory. You're going to monitor expiration dates. You're going to make sure that you store vaccines according to lot number and expiration date. Don't mix those all up. Transport vaccine, make sure you have the proper equipment to transport it. Also, vaccine is going to be transported on the inside of your car, not in the trunk, not in the bed of a pickup, but it needs to be inside. And then you're going to prepare for that. You're going to have someone monitor temperature on site, document that. You need to have a plan. So if you do store vaccine on site at your own physical location, you need to have a plan. What happens if the electricity does go out for a long time? What happens if my unit does break? So make sure that you have the equipment to move that vaccine. Make sure you have made a partner, either your local health department, your pharmacy, your hospital, so that you can actually transport that vaccine to someone who can store it for you until you get your electricity up or you replace your unit. You want to have your standard storage and handling plans in place. You want to have an operating procedure. You want to make sure that you have somebody assigned to your vaccine, and then you have a backup, and that they know what to do in case of an emergency.
Yeah, I was curious how many of, let me put that. What kind of errors those of you who have already hosted vaccine clinics, what kind of errors have you seen? There are common errors. So I just launched a poll, if you could read through that and take it. Have you seen vaccines left unattended on the counter? I think one of the biggest errors that we see is making it only one person's job to worry
Yep.
about. But read through these and let us know what you've seen. I'll give you just like 5 more seconds here. Oh, none of the above. That's good, William. Send us your SOPs. So we can do whatever you do. I think leaving them on the counter when they at delivery is a big one. Make sure if you are going to have a fridge, a vaccine refrigerator or a freezer, and the product is going to be delivered to your, say your corporate office or whatever, anyone who could potentially accept that order needs to be trained. And we cannot tell you how many times we've heard at doctors' offices where, everyone's familiar with vaccines. It's part of their day-to-day, what they do every day. And a delivery will come, at Friday at 4:00, and the vaccine coordinator is on vacation or left early for a long weekend that time, and it just sat on the counter for the weekend, and all of that vaccine was wasted. It happens all the time to people who think about this all the time. So make sure wherever things are getting delivered, they all need to be trained.
Yep.
Or have policies in place that only certain people can sign for those deliveries. They can only go into a certain door or into a certain department. Vaccines end up in the fridge that belong in the freezer, or in the freezer that belong in the fridge. That again goes back to training. I think one of the ones that's most frustrating is because you'll have a temp log on your fridge, right? That someone manually, how often are they checking their temperatures, Macrina?
So you're supposed to check them twice a day. And it's amazing how many times we see that someone's been writing down 31, 28 on the refrigerator, and it's been happening for days on end, and that there's not a connection that I should be writing down something between 36 and 46, not something below 36 or over 46. So I think part of that is just making sure that when you write down that temperature, that you make sure it's the right temperature.
Right. Well, or that you do something about it
Right.
if it's too high, you have to actually do something about it, especially if they're using a fridge without an alarm. Keeping packed lunches, that's a third of, we've seen pictures of wine in vaccine refrigerators. You can't do that. The vaccine fridge is just for the vaccines. So.
Yeah, it's water bottles, not wine bottles.
Yeah. So training resources, so you call the shots for CDC, and if they're VFC providers, they take that at least once a year, right? And,
Correct.
And whenever a new vaccine comes out on the market. And what, if you just start your job. And then
Right, if you're VFC, it needs to be a primary and a backup.
Thank you, yeah. And then the CDC's vaccine storage and handling toolkit as well. Any other research training things for storage and handling? I mean, it's really, you just kind of, you call the shots is a great training course, but there's a lot of information.
It's a lot of information. I think my favorite resource is for documenting temperature, where actually it is red. So if it's above 46, if it's below 36, it's in red. And I think that is really helpful, because if you go to write a temperature down and it's a red, then that should tell you that there's something wrong. So I find that to be probably the most useful too.
Yeah, any places in your process where you can build in visual cues to help people do what they're supposed to do. And that's going to be so much more important for these folks, because this is not what they do every day.
Well, exactly. And I think what we need to keep in mind is that even though you have a primary and a secondary who's in charge of vaccine, also I recognize that you're the primary probably for 3 or 4 other things in your organization. And so the more you can build in sort of those safety nets and tools is the best.
Right. So there are 7,278,717 Arizonans. That's a lot of Arizonans, and we want them all to have a flu shot. But we are idealists. Maybe someday they'll all have one, but we're also realists in that we know not all of them will get it this year. But what tips can you give them on how many doses to order and how to plan for that?
I'm gonna say hope for the best and expect the worst. I think if you at a location where you have a good partnership with someone who can kind of help you problem solve that, like at the church, they have 3 services, 50 is the max. So we thought, okay, well, 100 and maybe 175 is the most we'll do, right? So I think that's the best way to sort of handle it. You really don't want to take out a lot more vaccine than you actually need. So I guess the best is just to try to best and guesstimate it the best you can, and just have a plan for if you run out. One is, do you have someone who can run back and pick up more and bring it out? Or keep track of your inventory, and it's okay if you have to hang a sign and say, we just saw way more people than we expected. Can you schedule and come back at a later date? Are there referrals where you can send folks to other locations to receive flu vaccine? This is one piece that is not really an exact science. Mm-hmm. But again, just keep track of that inventory in the back. When you're there administering vaccines, have someone in charge to let the site coordinator know what is your minimum that you get to, that you're going to start to panic.
And if you have tips on how you've figured that out, please chat them in or talk about them, because when it comes to let's just open up shop one day and bring in lots of people, you're the experts in that. So, the public health, Macrina does a lot of like targeted outreach. Hep A outbreak, she's there. She can watch her coolers. She'll go to encampments. She'll go under bridges. But you are really the experts in this model. So we need you to start talking to each other over the next year so that we can.
Right. And again, keep in mind that my staff have been doing this for a really long time, some as many as 30 years. I think my least experienced nurse has 10 years experience. And we recently did a flu program where someone had to go back to get more flu vaccine twice. So no matter how many times you've done this or how much you've got this down, there's going to be that issue where someone's running back to get more vaccine, which is really a good thing.
Yeah. So we've talked about selecting a site. We talked about storage and handling. Let's talk about are there any other questions first about, so people are kind of chatting in some things about the COVID vaccine that you're already thinking about being concerned about storage and things like that, which, yeah, we hear you, but we'll all wait until we actually know what the vaccine is before we start really providing training on it. But yeah, we agree. Any other questions or things on storage and handling? So William's saying our last 4 drive-through flu shots averaged 300 with a population of 3,500 in Heber Overgaard.
Wow.
That's awesome. Any recommendations on where to find data loggers? So if you are providing VFC vaccine, they have to meet certain requirements, right, Macrina?
Right. We just go through, we actually go through the same company that we purchase our syringes and Band-Aids and cotton balls and alcohol from. And most medical supply places will have data loggers, and a lot of them meet VFC requirements.
Okay. And we can make sure that we email out, I think there's a web page on ADHS's website about that.
I think so too.
Email that out to you. Anyone else have tips on how to expect the number of people? I mean, if you planned for 200 and 600 show up and you can't get your hands on 400 more shots, well, guess what? You protected 200 people from flu. So it's not the end of the world if you can't get your hands on more shots. But but that's where those partnerships are important, and having bodies available to go get them. So let's talk about staffing a little bit. And I think that I would love it if you could chat in too, especially if you've done it, like William, looks like you've done it already 4. How many staff did you need to immunize those 300 people? That would probably, and how'd you go about figuring that out would be helpful. There are 4 things that you need to happen at your mass immunization clinic. First is that you need to have a U. So you need to have someone whose job it is to know everything about the event, and to be able to plug and play into any of those spaces if needed. You need to have someone or a group of someone's whose primary job is to greet patients and screen them for COVID-19 symptoms. Because if they are yes, on whatever screening questionnaire you're using, then you need to send them home. You can't have them there, obviously. You need to have people who are trained in verifying insurance, especially if you're going to bill. And what's that process going to look like, or what do you have to collect for the billing office? Like if you do use TAPI, they're going to make sure that you collect certain things and information from patients. And they're also going to have to be trained on ACEs and know how to look up patients to see if they already received an immunization or not. And then obviously you need people to screen for precaution and contraindications or administer vaccines. And cross training is important, but the biggest mistake that we've heard from fire departments who've done these things is not having a backup. So make sure what you are doing, you do have a backup and somebody who knows, almost as much as you do about any particular event. This is, always important to have a backup on things, but now that we are in a pandemic, I mean, your policies. If you got a fever the day before, you would not be able to show up there. And people are going to people are getting sick still. So whether it's COVID sick or other kinds of sick, if you have a fever or you have other symptoms for COVID, if you would fail that screening questionnaire, then somebody's going to need to know how to be there and run the event. And then other kind of staffing that you need to have runners. I mean, it'd be nice to have runners that can kind of plug and play, that can go pick up more vaccine if that's what's needed. That can, if you're doing a drive-through clinic and they're all waiting in their cars, that can kind of walk back and forth and through the aisles every now and then to see how things are, if anybody's kind of hunched over, or kind of get visual cues from people, a thumbs up that they're doing okay. You might need people directing traffic. And then you also are going to want to make sure that you have folks on standby. So who are you going to call in the event that you need more bodies because you get 300 people instead of 50 people? And you're going to need to train your staff, everyone, on certain things. So we've talked a lot about storage and handling, and the best resource for that is CDC toolkits, which we'll make sure we send you out. You need people trained on inventory management and how to do ACEs. And what's the name of the ACEs thing they need to do, Macrina?
So right now you all want to do the ACEs onboarding for COVID vaccine. So we don't know what vaccine's coming. We don't know storage and handling. We don't know scheduling. We know nothing about the vaccine so far. What we do know is that you need to onboard to ACEs to be able to get the vaccine delivered eventually. Go ahead and onboard, even if you don't know onboard. Right. It's going to be easier to do it now than it is once vaccine's available and ready to ship. So everyone on board now.
And that'll help tell them who all needs, because every person that shows up doesn't necessarily need to know ACEs. It's just the people who are going to be throwing that information into ACEs. And Lynn's chatting in a really good tip to make sure that you have relief staff for each area for breaks, because clinic's going to go for several hours. Thanks for saying that. You also need to train your folks on how to administer vaccines. Maricopa County, that module we talked about, they have a really, really great one on administering to adults. For children, it's a little different because you want to make sure that folks are trained how to appropriately hold a child, comfort hold, we call it. We don't call restrain when we talk about vaccines for kids, but how do you hold a child if a parent's not comfortable doing that, or just, is not able to do it for whatever reason? I don't know where they can look at, we don't have videos for kids, huh?
There are some videos for kids out there. You can definitely watch them, but I think the best thing to learn how to immunize a kid is to actually work alongside somebody who's actually done it before.
Mhm.
A little bit more of a skill set. Again, it doesn't take long to learn, but it's always nice to have some hands-on training with someone who's good at it.
And if you need that for your folks, just let us know and we'll be able to help do that. We'll send Macrina in, or one of her nurses with her dolls. The other, what was that?
We're gonna go to a real clinic, and they're gonna watch me do one, and then they're gonna do one.
There you go.
Yeah.
A lot of times some people say the kids are easier than the adult. They don't go like this when they're held. Maybe not the teenagers, but
Everyone has their own unique way of handling immunizations.
The other thing that you need to train them on is your policies and procedures to reduce errors, and we will go over that on the 22nd. And plus, of course, they need training on HIPAA. They need training on what's a typical reaction for a vaccine. Who is the key contact information? Make sure everyone at that event knows each other's cell phone numbers, because you're going to need to be able to communicate and have that list posted for your staff so that they know where to find all that information and what your procedures are. The one thing about HIPAA, for those of you, because most of you are going to be managing these events, if your PIO has informed the media of this event, just know that you would need to get consent from all of those people receiving vaccines to have their video taken, right, Macrina?
Right.
Yeah.
So just make sure that if you do send out a press release and you want media coverage, we have a consent to photograph. And we're very cognizant, and some people do not want to be photographed, some people don't want to be on the news. So just make sure you have those available.
Especially while receiving a healthcare service. So, any other kind of tips that you have for each other or questions around staffing? I think as long as those 4 key things are done, you have someone whose job it is to know everything and a backup for the event. You have people screening for COVID. You have people who are trained on the insurance eligibility and the ACEs. And then you have people who are trained on how to how to actually administer the shot, then you'll be fine. And depending on your target population, the size of the group, you might need other things. Some of you might be, if you're doing an event just for city employees, or just for your fire department, and you're only expecting 50 girls and guys to, kind of show up, then that's a really great practice round for something bigger. But you probably don't actually need that many bodies there, staff there. So it's just all going to depend. We heard of a health center in Coconino County that did like 100 and some people at a drive-through clinic with 3 staff members. So I think that if you just have to know what your staff and employees know how to do and where they need help. All right, so we have like 5 more minutes. We want to make sure that we get questions, but also, here's a good William saying from 8 to 11, 2 lanes, 4 shooters, 2 check-in. Oh, that's great. So that's how he staffed those 4 drive-through events. And he did 300 people at one of them, which is amazing. So next, on October 22nd, it's a Thursday from 9 to 10:30 is our next training. And we were thinking of talking about screening for contraindications. So how do you know whether that patients should receive the vaccine or not, which for flu is pretty darn easy. Right? Isn't flu that
Yeah, pretty much. Have you had a flu vaccine since, we always ask, have you had a flu vaccine since August 1st? And if they say yes, then they don't need one. If they say no, don't say, have you had a flu vaccine this year? Because a lot of people may have received it in January and February, and they're going to say yes.
right? And we're also going to talk about for, medics, you are able to screen for contraindications, but some of your departments, your medical directors, they may want, depending on how they write those standing orders for you to be able to administer vaccines, they may want you to have an RN there, or they might want to be there to be able to screen those patients. So, but we thought about talking about that, about errors, a little bit about inventory management, which really will give you kind of a broad overview, but you just need to take that ACES training system, which just got chatted into the chat box. What else we're going to talk about drive-through clinics next time. What else do you feel like you really need to hear about? Or do you need us, like, was this too basic and you need more information about anything that we talked about today? A very quiet group. Not too basic, that's good. Oops. Well, I wonder if we are can we chat in and put in the chat box the evaluation? We'd love it if you could take this, well, for feedback for us, but also give us ideas. We are going to be approaching kind of crunch time. For those of you who are doing flu shots, we really, really want you to this is our chance. There's like a lot of cool things happening right now because of COVID, right? This is our chance to test what works and what doesn't for a COVID-19 vaccine. Like this whole idea about drive-through clinics, this has never happened before. We've never done that before. And if it bombs, if it really doesn't work well, then when COVID vaccine comes out, we're going to know to not do drive-through clinics. So, but the only way we're going to learn that is if everybody's really, talking together. That's what TAPI believes our role is to get folks talking together. And if it goes really well, like this drive-through clinic idea, and we can immunize, more people than ever before, then it can transform not just how we reverse and respond to the pandemic, but how we protect our community from flu every year, forever now. I mean, flu kills tens of thousands of people a year. It is a serious, serious disease. And we only immunize about 40% of our population against it. So if what we're learning works for these mass clinics for vaccines that you need every year, like flu, which isn't like measles or pneumococcal or mumps or pertussis, it's like the one of its kind, then we can really protect, we can really change the health and safety of our communities. So that's why TAPI is really excited and wants to make sure that we're getting the right information to you, and so that we can learn from you, because really what we're doing this for is to learn from you and what you do. So, if you don't have other questions or comments, you can, oh, William, it looks like you have a question. Can you talk about how maybe we can tag you, William, to talk at the next training when we talk about drive-through clinics. Maybe you can talk to us a little bit. Would that be okay if we reach out to you? Other people.
So, that's a challenge for us even at Maricopa County, is how do you keep people, I can't keep people in a waiting room for 15 minutes, let alone if they're in their car ready to go.
Okay.
They've already gotten to the, I'm missing a step. So that's a challenge. If anyone's got any great ideas.
All right. Oh, and he's saying that he will be able to help us. So that's great. And Doug's saying they use an app called Eventbrite to schedule a drive-through backpack giveaway for school. It worked. Oh, that's kind of neat. Yeah, all those resources are awesome. Oh, great. And Manny emailed. Yeah, keep emailing your stuff. Hopefully, maybe we'll reach out to a couple of you to see if you can talk a little bit more at the next training, which is scheduled for Thursday, October 22nd. So thank you all so much. We're really happy to be able to do what we can to help you and to be able to work with you. Thanks.
Thank you.
And yes, Nancy, we'll get a recording. All right. Bye, everybody.
Bye.